Hello, welcome to our recap of the confirmation hearings for Robert F. Kennedy Jr. to be Secretary of Health and Human Services. I'm Julie Rovner, Chief Washington Correspondent for KFF Health News and host of our weekly health policy news podcast, What the Health. I'm joined today by two of my colleagues, Senior Correspondents Arthur Allen and Phil Galewitz. Phil was at the hearing Wednesday at the Senate Finance Committee, and Arthur is just back from today's hearing at the Senate Health, Education, Labor, and Pensions Committee. We're going to talk amongst ourselves for 15 to 20 minutes or so. Then we will open it up to your questions, which you can submit using the Q&A function on Zoom or the chat function on YouTube Live. So off we go. This has been a much anticipated set of hearings because Kennedy is, shall we say, an unusual choice to lead the nation's largest domestic agency, which is in charge of nearly all the nation's major health programs, from Medicare, Medicaid, and the Affordable Care Act to the National Institutes of Health, Centers for Disease Control and Prevention, and the Food and Drug Administration. He's not a doctor nor a medical professional, and he's never led any kind of large organization. He's also, until last year, been a lifelong Democrat about to serve in a very Republican administration. So I guess my biggest question to you guys going forward is whether he's going to actually get this job. Did we get any hints from these 2 days of hearings?
Bill, I think you're
right now, I'd say it's on razor's edge. He clearly doesn't look like he has much support among Democrats, and he can only afford to lose 4 Republican votes. And Senator Cassidy has definitely shown some skepticism about whether he has enough trust in RFK Jr. that he's going to change his beliefs on vaccines and some other issues. And three other senators may also, from the Republican side, may not support him. So right now it's on edge, and we may not know until the vote comes sometime the end of next week.
He can actually only lose 3 Republican votes. If he loses 4, then that's 49. So that's, in which case there's no tie to break. So he can lose 3 as the new Defense Secretary Pete Hegseth did, but he can't lose 4 unless some Democrat votes for him. Arthur, what are you seeing from what you can tell?
Everyone that I talked to today said, and yesterday said, that Cassidy was kind of the key vote. Cassidy, is a pretty conservative Republican, but he's also very pro-vaccine. He's a gastroenterologist, and he expressed, a lot of really sharp, concern about Kennedy's position on vaccines. And clearly, after 2 days of Kennedy saying one thing that totally contradicts what he's been saying the last 20 years, the question is, as Cassidy asked him, are you really going to turn over a new leaf? So I guess the question is, does Cassidy believe he can turn over a new leaf, or does Cassidy believe he can convince himself that he can decide to believe it?
So one of the big takeaways from the hearings is how little RFK Jr. appears to know about many of the programs he would be overseeing. We have a clip from today's HELP hearing of him being questioned by Democratic Senator Maggie Hassan of New Hampshire.
During yesterday's hearing, you really showed a lack of knowledge about Medicare and Medicaid. So what is Medicare Part A?
Medicare Part A pays mainly for primary care or physicians, and then Medicare.
No, so it is about Medicare Part A is seniors coverage for inpatient hospital care. What's Medicare Part B?
For physicians and doctors. Medicare care Part D.
That is coverage for outpatient care and home health. So what is Medicare Part C?
Medicare Part C is a program where it's the full menu of all the services, A, B, C, and D for Medicare.
It is Medicare Advantage, which it's the private insurance option for seniors on Medicare. So, Mr. Kennedy, you want us to confirm you to be in charge of Medicare, but it appears that you don't know the basics of this program. So let's turn to Medicaid. No, I had to correct you on several things.
So this, of course, followed yesterday's hearing at the Finance Committee, where Robert F. Kennedy Jr. kept talking about Medicaid's premiums and deductibles being too high. Medicaid doesn't, except in a very few unusual cases, have premiums or deductibles. Medicaid is for people with very low incomes. I want to ask each of you, sort of Phil and Arthur, what stuck out to you as things that you think he probably should have known but didn't? And certainly if he didn't know yesterday, you would have thought he would have boned up on them by today.
Sure. He definitely confused the two. And to be fair, the average person confuses Medicare and Medicaid a lot. But this is the person who's going to be in charge of the program. He's going to be overseeing the program. Person needs to know. But he didn't know as far as how the programs were funded. He talked about how Medicaid was a federally funded 100% program. And that we know is definitely not the truth. It's a split between the states and the federal government, where states pay about 31% on the average of the program, and obviously play a huge role in the program of states. So that's a real basic knowledge. He was also asked yesterday at Senate Finance about the role that Medicaid plays with births in America. And that he was asked sort of how big a role do they play? And he didn't know. He said, I don't know how many births. And then he guessed 30 million. There's only about 4 million births in the United States each year. So his 30 million guess obviously was way off.
So Medicaid pays for a lot of births in this country. I think it's about 40%, but obviously it's 40% of 3 million, not 30 million.
Correct.
Right. Or 4 million.
Yeah, 4 million. Arthur, what stuck out to you as things that normally a nominee for this position would know that he didn't?
Well, I mean, I guess for me, the biggest things that stuck out were just his refusal to accept any kind of accepted science in most of what he was talking about. And it's not exactly the same as what Phil was talking about with Medicare and Medicaid, or where he just was ignorant of these things because he apparently hasn't paid any attention to them and wasn't briefed on them before his hearing, which is surprising. Just his level of acceptance of evidence. I mean, there's nothing that you can know with 100% certainty. But he talked quite a bit about how science is always changing, and that's true. But, there are also things that at any given time are accepted science, and that's based on a lot of research, and it's also based on, consensus statements and IOM reports. I mean, he was saying at one point, the IOM should look into vaccine safety. And it's like, they have, and they found, that vaccines don't cause autism. So that kind of thing jumped out at me.
So obviously, and Arthur, you mentioned this already, Kennedy's biggest red flag for many senators has been his outspoken and longstanding anti-vaccine advocacy. Among those most concerned, and obviously, as we said, the potential swing vote, has been Senator Bill Cassidy of Louisiana. He's both the chairman of the Help Committee, which held the hearing today, and he also serves as a voting member of the Finance Committee. And the Finance Committee, of course, is the committee of jurisdiction here that's going to vote on this nomination. Here are some of Cassidy's comments from today.
And there are many things you and I agree on. We're in total agreement on the need to address ultra-processed food, to reduce obesity. And obesity, of course, the leading cause of chronic disease and therefore of shorter lifespans. And this will be a priority in this committee, and I look forward to collaborating with you if you are confirmed. But it's no secret, I have some reservations about your past positions on vaccines and a couple other issues. So as a physician who's been involved in immunization programs, I've seen the benefits of vaccinations. I know they save lives. I know they're a crucial part of keeping our nation healthy. Now, Bobby, I've learned you got a tremendous following. My phone blows up with people who really follow you. And there are many who trust you more than they trust their own physician. And so the question I need to have answered is, what will you do with that trust?
So Cassidy is clearly struggling here, and he, we all waited till the end of the hearing because often a chairman in his closing remarks will give some indication, particularly in a nomination hearing like this, of which way he's leaning. And he was very careful not to say at the end of this hearing. My question for you guys is, what would Cassidy's vote mean one way or the other? Would he bring other people with him?
Well, I don't know the ins and outs of relationships of all these senators, but I mean, everybody I talked to, including people from Children's Health Defense, the group that um, Kennedy led until recently, said that Cassidy was, the deciding vote. And when I mentioned Collins and Murkowski, they were like, so they're not counting on their votes. So I think he's terribly influential. I mean, he's a very smart guy. He's not a silly guy. So that was my impression, is that, he said he was going to wait over the weekend to decide. Um, that's going to, he's going to meet with Kennedy apparently again. But, I think that's crucial.
Right. I don't think he's going to sway other senators. The question will be, will his extra vote be enough to put him over the top in terms of blocking his nomination? I mean, I think he sat next to Senator Rand Paul, another physician on the panel, and clearly they have opposite positions, and I didn't see one influencing the other. And again, that was similar yesterday, where a number of senators didn't get into the vaccine issue at all. Their issues were, hey, make sure rural health is taken care of in a vague way, and don't try to touch agriculture policy was their issues. So,
But I don't think we got Murkowski and Collins. Neither of them really gave played their hand very closely. But I think the assumption is with them that they've already voted against one of Trump's appointees, Hegseth nominees. And so, I think if you follow common sense a little bit, or a little bit of the conventional wisdom, you're not going to vote for this guy. But if you're just deciding that you have to follow the party line, then you will.
When it comes to his anti-vaccine advocacy, one of the people that a lot of people are looking to is former Majority Leader in the Republicans, Mitch McConnell, who himself is a polio survivor and has already had some pretty severe things to say about people who don't believe in vaccines. Is there any expectation, A, that McConnell might vote for him, and B, again, if he doesn't like Cassidy, could he bring others with him? He also voted against Hegseth, and that was a surprise. I don't think it would be a surprise if he voted against Kennedy.
Yeah, he was careful not to mention Kennedy by name when he made the comment, I think in December, saying that it was dangerous to ignore proven science. But when he was talking about polio vaccine, but he didn't actually mention Kennedy. But who knows what goes on in the back rooms, deals that might be made if you support somebody. But he certainly, if you compare him to the others who are unlikely to go for Kennedy, he certainly doesn't seem like he would. But then there is just a very strong, Trump has incredible power right now in the Republican Party, and I wouldn't be surprised by anything. I do think it was striking, during this hearing, just how both hearings that Kennedy was, repeatedly saying he'll accept current things like the current vaccine schedule, and at the same time saying he didn't think vaccines were proven to be safe, that he's waiting for evidence. It's like, if he hasn't found the evidence he likes yet in 20 years of attacking vaccines, I don't think he's going to find it in the next, couple months.
And that seemed to be the issue that Cassidy was struggling with, that Kennedy kept saying he believes in the science, that if you show him science that disputes what he has believed, he will change his belief. But we've not seen that in all of the years that he's been talking about this,
and
right?
then Cassidy actually brought in a gigantic meta-analysis of 1.2 million kids or something, showing no evidence of measles vaccine causing autism. And he said, well, look, this was published 11 years ago. You didn't see this? And he was like, well, there are other studies. There's a new study that just came out that said maybe they do. So it's like, he'll never be satisfied. And actually Cassidy said, if you're never going to be satisfied, then, this isn't working.
And I think health experts want someone not just to be wishy-washy on vaccines. They want someone
Right.
to promote vaccines. Vaccination rates in this country have wavered in the last many years, and that's a problem. And so someone, even if you believe he's just going to be status quo, is that really what you want from the nation's top health official?
Right. And
Yeah.
how could it be status quo when the part of the reason that they wavered is him?
Yeah, and I mean, one of the issues is that he's kept saying, I'm not going to take vaccines away from anybody, and I'm not going to discourage anyone from getting vaccines. But that's not the same as Phil says, as encouraging people to get vaccinated, which is what public health has been the public health consensus for many, many years. And I know we will talk about public health consensus in a minute. Another issue where Kennedy is suspect, I think, among both parties is abortion and reproductive health. He's long been a supporter of abortion rights, and for now, we're not sure exactly where he is. He also doesn't seem to understand what levers HHS has when it comes to this touchy issue, as evidenced by this back and forth with Democratic Senator Kathleen Cortez Masto of Nevada at the Finance Committee Wednesday.
What authority do you have over this as the director of HHS?
What authority do I have?
Yeah, to enforce the law,
In what regards?
to make sure that a hospital that receives payment from Medicare is ensuring that they're providing the necessary emergency care to patients when they present. It's actually the EMTALA law. So what authority as HHS director do you have with respect to EMTALA?
My understanding is that I have budgetary power and that it's pretty much limited to that. But if you tell me I have another authority, I don't even think that
Well, let me tell you,
we
you
have a
do.
law enforcement branch at HHS.
Actually, you do, and that's CMS. CMS actually investigates complaints of EMTALA violations, as well as the Health and Human Services Inspector General, who, by the way, was just recently fired by Donald Trump. So you will be enforcing EMTALA laws, and it's important that you understand their impact and don't play politics with the patient presenting at the ER based on a position that this administration has taken.
Okay, to translate that a little bit, EMTALA is the emergency medical and active labor act, part of a 1986 law that requires hospitals basically to not dump patients who don't have insurance. That's why it was passed. But it also requires them to stabilize the patients or give them emergency treatment that they are needed, even if they don't have the ability to pay. Phil, how does this intersect with abortion?
Well, if people show up at the hospital and a woman is in distress, the options that a woman may have, if the hospital if abortion's off the table, that a woman's life could be in danger. And he's sort of saying, I'm not sure how I need to, if someone's dumped out, the hospital decides, hey, we don't do abortion, we're not sure we can handle this case, and they dump the patient. And here's the top health official in the country saying, I'm not sure we have these powers to fine hospitals for patient dumping. That's definitely a question. But EMTALA is a huge law, and patient dumping has been a huge problem over decades and decades about people showing up at the emergency room. And sometimes, very rare cases to be sure, that hospitals don't provide they're supposed to stabilize patients who come in, and if they don't, they can be fined a lot of money, and they can also lose access to Medicare funding, which in many cases, a hospital can't stay open if you're not a part of the Medicare program, because so much of your funding comes through Medicare.
Yeah, that's so. I mean, obviously, EMTALA is a big deal. The idea that Kennedy didn't know that there's basically enforcement mechanisms. Obviously not putting people in jail, though. I think HHS can sue people and can bring criminal charges. But the idea that there's no that all that they can do is withhold or not give them money is kind of a big deal at HHS. They have a lot of power over the healthcare industry writ large.
Yeah, I mean, HHS, Office of the Inspector General, they issue fines and they can suspend hospitals, but they have major fines, is what they can do at hospitals for millions of dollars. And the fact that he didn't know that was a little surprising.
So I'm going to turn to some of the questions that we're starting to get from the audience. Reminder, you can use the Q&A function in Zoom or in the question function in YouTube chat. Is there a plan B from Trump if RFK Jr. isn't confirmed? In other words, who would likely be the next person if this doesn't happen?
Ooh, that's a good question.
I don't think we know. I don't think we know for sure. But would it be likely someone with some healthcare experience? In some way, it's a managerial experience. I think it'd be a lot more likely if that was the case.
Mhm. Yeah, I mean, I've heard that, that some of Trump's aides have sort of tried to bring some to make sure that Kennedy has some people with HHS experience in his team, and maybe one of them would be chosen as to lead the agency.
Said a lot of the Republican comments to the candidate seem to want to assure them that he is not going to disrupt agriculture to meet his food-related MAHA goals, make America healthy again. Is there a world where the food policies would even be permitted to be addressed by Republicans? I mean, this is one of those places where Democrats, I think, are more sympathetic to his proclivities than Republicans.
But I mean, this gets into a solid issue where I think some Democrats agree that yes, some of the food policies, and agricultural policies in this country for decades have played a role in the soaring rates of obesity and thus soaring rates of diabetes and other health issues. But no, the HHS secretary has very little power, no power, to change the amount of money that's going to farmers and what we pay farmers to grow. It also gets into the question of that the whole MAHA movement about "Make America Healthy Again" is a great slogan, and it sounds great. I don't think anybody's going to be against being healthy, but there hasn't also been any specifics on what he wants to do to make people healthy. Yes, he wants to get rid of food dyes, and he's talked about that. He's talked about also reducing some additives, but then this whole question of what can go into food and what can't go into food, again, that's going to be some of the purview of the agriculture department, and also some rules on that play a role on what we can serve our kids in terms of federally funded meals that go to schools.
Right. And so the food bill, is just a giant package, and it's always, favored people who grow soybeans and corn and, which are produced for all kinds of, additives in food and so on. And they don't really subsidize, growing healthy vegetables. And then the other thing is that with they'll often, when you ask the MAHA people, well, how are we going to actually get to healthier people? They'll say, well, we're going to get rid of these conflicts of interest. That the federal agencies are all bought and paid for by industry. Well, even if that was true, I mean, so you're going to change you get FDA to ban some substance or to start new studies. I mean, I don't think you could just have them ban a substance that's considered generally safe now, but maybe you could start them on some investigations, do some studies. I mean, that would take a hell of a long time, and the result in terms of America's health would be, infinitesimal. So I don't know.
And they've talked about, trying to offer more healthier foods and give Americans a choice of more healthier foods. Well, anybody knows you go to the grocery store today, there's a choice of healthier foods. And people don't often choose that. We feed them, and they often some of those healthier foods, unfortunately, sometimes cost a little bit more than the unhealthy foods. So people make a choice. So if it's just a matter of a choice, that's what we have. That's what we have today. Can we better educate our children? Can we have better behaviors? That's certainly laudable goals. But how are we going to do that? We really haven't heard any specifics.
I mean, they talk about a bully pulpit, and maybe that's a real thing that, that he could be going barnstorming the country, telling people, kids to get he always says, like his uncle did, started the I forget the name of it, this physical
fitness tests.
Yeah. So, he could do that. He could go around saying, moms, you need to buy this and not that. So I guess that could have some impact. Will it counteract all the advertising? that keeps, all the media on the air. I don't know.
I just feel like all you need to know about the intersection between health and food policy was when they were doing the Affordable Care Act in 2009 and 2010. And there was a suggestion that one way to pay for it was to put a tax on sugary soft drinks, things that really are empty calories. Well, at the time, the chairman of the Finance Committee, who was putting together the ACA, was Max Baucus of Montana, a place where they grow a lot of sugar beets. And the ranking Republican on that committee was Chuck Grassley from Iowa, where they grow a lot of corn, which is how we get high fructose corn syrup. And surprise, surprise, that proposal went nowhere almost immediately. There seems to be that seems to happen a lot in healthcare and agriculture. But at least he's going to try to use the bully pulpit, I would think. Here's another question. When do you think the Finance Committee will vote on RFK Jr.?
We've heard it's going to be early next week. I think they want to get this done as quick as possible. So I think, I would assume by Tuesday or Wednesday at the very latest.
Yeah, I'm wondering if, depending on whether they have, I think, as we like to say, they vote when they have the votes. So if they have the votes, I think they'll vote sooner. If they don't have the votes, I think they might, or if they think they might not have the votes on the floor, they might delay the committee vote. I think, so that will be a good indication of how it's going is when they actually scheduled this vote. In what way might the RFK hearings influence or be raised in the Dr. Oz hearing? Dr. Oz, of course, who's now been nominated to head the Centers for Medicare and Medicaid Services, which is the biggest sub-agency of HHS. Does this tell us anything about how that might go?
Sure. I mean, I think if the centers decide that positions that these gentlemen took for years and years, if they say that's how they're going to vote, in this case with RFK, I think they will do the same with Dr. Oz, and they will not let him sort of say, hey, I'm going to change my ways now that I'm going to be heading up CMS, that they'll hold people accountable for what their positions were before they were nominated. So I think it certainly could have implications for Dr. Oz.
What did RFK Jr. say about mifepristone? That's the abortion pill that obviously anti-abortion forces would like to see have its approval revoked by the Food and Drug Administration.
Yeah, he totally, as I recall, he totally dodged it and just said, I'll do what Trump tells me to do, basically. He said, Trump will have a policy on it and I'll follow that.
In finance, he sort of hinted that, hey, I think it needs more study. That, hey, I think, I'd like to, hey, if people want more study, I think we should do more studies. Obviously, most health experts and all the Democrats on the panel say, hey, this thing has been studied for decades, and we know the impact. So that definitely raised the eyebrow. When anybody says something that's been around for decades and has been proven largely safe in the overwhelming cases, definitely raised some eyebrows.
Yeah, I mean, I think it's always, you can always fall back on, well, we need more science. That's always a good way of having making a decision about something or not making a decision about something that's pretty obvious to the scientific world.
Here's what it said. I thought I saw a few on the fence Republicans, Senator Murkowski and Collins, who we've mentioned before, Lisa Murkowski of Alaska, Susan Collins of Maine, who sounded fairly receptive, as did a few Democrats, and Kim of New Jersey, John Hickenlooper of Colorado. Was this a surprise, and might this change voting dynamics?
That is a really good question. I mean, I think the Democrats will be whipped, to vote against him, I'm pretty sure. But what does that mean? I don't know. That doesn't mean they can't vote the way they want to vote. Hickenlooper was very polite. He's always kind of polite. I mean, I don't think that means he's going to vote for him. And Kim just asked some kind of neutral questions that he was neither, I would say, encouraging nor discouraging. Yeah.
Yeah, I think people do sometimes mistake politeness for support,
Right.
which is why you sometimes can't tell how people are going to vote.
Right.
But Phil, you're not hearing anything about, I mean, with the exception, I think, of John Fetterman from Pennsylvania, who's kind of a wild card on a lot of things. There hasn't seemed to be any indication of Democrats who are planning to vote for this nomination, are there?
Certainly not from what we've heard. We haven't heard any Democrats say, "Hey, yeah, this is the best we can do in the country." Certainly on finance, I can't recall that we had any Democrats as cheerleaders. Some were harder questions than others, but certainly didn't hear anybody sort of come out and say, "Yes, I'm ready to support you."
Yeah. Yeah. I mean, people have mentioned that White House was his law school roommate, and Booker, has said some things positive about the MAHA idea, the fighting chronic disease, but he hasn't said anything more than that, I don't think.
Yeah, I don't think Sheldon Whitehouse is planning on voting for him either. I believe his exact quote was, frankly, you scare people."
Yeah, that's
That
right.
did not seem to be much of a strong endorsement.
No.
RFK tweeted that he would remove fluoride from drinking water on day one. Does he really have the power to do that?
I don't think so. I mean, I think it's usually up to counties, right? Who decide. Yeah, so that's, about as likely as ending the war in Ukraine on day one.
But he sort of can use his box to stand on that can increase the amount of counties and cities that may want to relook at it.
Yeah.
So right now we've had a number of counties and cities turn off the fluoride, and whether that would increase under RFK Jr., I think a lot of people say certainly.
Yeah, and I don't know if there are carrots and sticks he can use to encourage or discourage in that area either.
Well, he clearly doesn't know about a lot of the carrots and sticks that there are at HHS, but there are a
Yes.
lot of them.
Yeah, yeah.
But yes, I don't think he has a lot of authority over fluoride. Here's a question about DEI. When it comes to DEI dismantling, can someone explain the impact on public health, population health, and Medicaid? Does DEI dismantling eliminate health disparity work altogether, or how may it negatively and positively impact? This is a question I've had too. What does it really mean to get rid of DEI? There was a question in the Finance Committee about increasing clinical trial participation among Native Americans, where Kennedy said, he would absolutely do that. And I thought, isn't that DEI? Isn't that part of the whole, equity issue?
I mean, it's like so many things where, you just don't know how it's going to shake out. Where they come up initially with these very blanket statements or orders that then people make noise about, and then maybe some of them will be changed. I mean, the idea that DEI means banning DEI means that you shouldn't have representative populations of the country in your clinical trials. I mean, I don't think that's really a DEI question, but apparently it was covered in this order. I mean, because it does refer to diversity and inclusion, in the documentation of these trials. I mean, are they going to back off that? I mean, who knows?
I mean, my question is, what about orders from Congress to increase, clinical trial participation among women, to look at, at issues differently? I remember during COVID when we discovered that people with darker skin can't use pulse oximeters, that pulse oximeters don't work on them properly. I mean, there's an awful lot of things that are differential that science does look at. I mean, there's an enormous body of work right now going on health equity that has to do with, with race and income and geography. I mean, does all of that get canceled out?
Well, interesting that RFK Jr. in the hearing today was saying that Black people respond to vaccines differently, that they have better immune systems, is what he said, or stronger. I don't remember which word he used, which then Senator Alsobrooks said, "So are you saying I shouldn't have gotten vaccines?" And he was like, "Well, no, not exactly." But and then she said, "That's kind of crazy." And he said, "Well, it's science. It's difficult." So I guess
he also said yesterday that he acknowledged, saying that the AIDS virus is different in Africa than it is in the United States. That it's a different virus. Right. And he tried to explain that there were different diagnostics somehow in Africa than here. But again, sure, showing his knowledge of
yes, that's right.
RFK Jr. declared that healthcare costs are much higher in the United States because of the higher rates of chronic disease. He said that several times. Is this correct or not? What about administrative costs, higher prices for services and goods, technology, insurance costs, litigation, and limited access to preventive care?
I think you just answered the question, Julie.
Yes.
Yeah, I do too.
Yes.
Right. As people used to say, and Julie probably quote who said this, the reason why we pay more in the United States is because our prices are higher for healthcare.
Hoover Reinhardt.
Is the number one reason, is our prices are higher for virtually all healthcare.
But yeah, if there's more care because there's more, sick people or, with chronic, I'm sure that's true also. That's part of it, but it's not the whole explanation.
So,
But and again, chronic disease is not something that started 10 years ago or 20 years ago or
Right.
30 years ago. Chronic disease obviously has increased with the population, and it has increased, but it's been a problem for many decades.
And so have treatments, and I mean treatments for these diseases, and that adds to expense. But before there were, people just drop dead of a heart attack was like something I would hear them talking about all the time. Oh, so and so dropped dead of a heart attack. I mean, people don't drop dead of a heart attack quite as often as they used to, and that's because there's medicines, and the medicines cost money.
Right. And one reason why we talk about chronic disease more today, in a sense, is because we've done such a good job in this country in treating infectious diseases and in treating diseases that kill people when they were babies and young. So people are living longer. Except for the dip we had during COVID, that life expectancy has generally increased over the last 30, 40 years. And because we've done such a better job at the early stages of life and then dealing with infectious disease. So that's why we now need to focus, because people are getting, when you live, you're going to die of something, and people are getting these chronic diseases, and they're often living with them for decades and decades. But I think one of the reasons why someone says, hey, we've had lack of focus, is because we've done in many respects, such a good job dealing with infectious disease and childhood diseases.
another question. Given Kennedy's skepticism of science, do we know anything about how he might change or reallocate available research funding in ARC, NIH, et cetera? Obviously, these are all agencies where, panels of peer reviewers decide what grants get funded and what don't.
We don't. I don't know if Arthur wants to lean into that, but I'm
I
not
mean,
sure.
I think, Congress can, I guess, allocate more money to different centers that might affect that, what pools of money are available for those grants in different areas. So, but I mean, it's not like, the centers that fund chronic disease don't exist. I mean, they do. That, probably the bulk of the research at NIH still.
He
And
did
RFK
talk about, he's
hasn't
talked
talked
about
about it.
coming in and cleaning house at FDA and at NIH. That we're already seeing efforts to downsize the federal workforce. And a lot of people are being fired who theoretically have civil service protections. Would you expect him to actually come in and start trying to clean house?
I think they'd like to. I don't know what their methodology is going to be exactly. I mean, he said today he said that they're going to get rid of bad scientists and instead but not fire the good scientists.
I think there'd also be a question of how many people at these agencies are going to want to stick around. Is this the leader that they want to take direction from for their career for the next 4 years?
Right. And how much is he going to interfere? Because, if he's just talking a good line, but he leaves a lot of the control in the hands of actual scientists, the scientific endeavors may be protected somewhat. We'll see, I guess.
Well, a question along those lines. Those of us at higher risk, went away. Those of us at higher risk regarding COVID-19 are extremely concerned that if confirmed, Kennedy could block access to mRNA and other vaccines for COVID-19. He could also stop funding for developing nasal vaccines, stop funding for developing new treatments for COVID-19. How involved do you expect he might get in that kind of sort of micro workings, if you will? I mean, being the head of HHS is a very busy job with an awful lot of stuff that does not involve this kind of micro workings.
I mean, the way I view it is it's a question of how much like the sort of mobilizing the base, mobilizing his followers, how much can you make that the focus of your enterprise as a cabinet secretary? And I mean, I don't know. I mean, with Trump, that's clearly, every day some new crazy thing coming, I mean, or some new idea coming down the pike, that's never been discussed before and that throws off everyone off balance. So, I mean, could he lead a campaign to say, there's been a cover up of mRNA vaccine injuries, and we're going to stop, distribution of the vaccine. We're going to take away its licensing. It would be really, really unusual. But you could, if you look at it in political terms, I don't know, maybe that's effective. I'm just, talking out of my hat here.
I mean, clearly they're going to pick out. I mean, I think most HHS secretaries pick out 3 or 4 priority areas that the president agrees with them to focus on. In the last couple of years with Secretary Azar, obviously maternal health has been a top issue. Increasing insurance coverage has been a top issue. So it's a matter of, yes, he's probably going to pick out 2 or 3 issues. We know improving Americans' diet would be one, and then this broad thing about chronic disease would be another. Whether he decides to make mRNA one of those top, again, it'd be hard to believe that would be a top focus today.
So here's a very pertinent question. Curious to know if there were any questions about the avian flu and how he would handle a response to a potential pandemic, especially considering the current freeze of federal health communications, which is impacting the agencies he would oversee. I thought there were 1 or 2 avian flu questions, but I also saw people on social media saying, hey, somebody asked about like the emergency happening right now.
He did say he would support an avian flu vaccine. Yeah.
Was that pretty much it in terms of?
I think that was pretty much it.
Did Kennedy?
There was no sound in Senate Finance. There was no sounding the alarm. It was no, hey, this is something that we need to know on day one. The question may have come up about, are there how this is affecting the poultry production in the United States, but there certainly wasn't any alarm that he had sounded in his remarks from RFK.
Yeah, I think at one point he said pandemic preparedness is part of your job at HHS. Sort of a throwaway line. He didn't give any specifically talk about, avian flu.
Right. There were a bunch, never say if they throw away lines, but there were a lot of sort of keywords that I think he would use. Like, I think when they asked about Medicare, Medicaid, he mentioned, hey, we need to go to a value-based system, which again is, and these days it's almost sort of, it sounds good that, hey, we should pay for value is a good thing, right? But there was no specifics on how we should get there. And health outcomes is another, it's a great word. We hear more about, hey, we got to get better health outcomes. Sounds good. How do you get there? No details.
Yeah, there was a question on exactly that, about does he have any ideas on value-based care, how to get there, or improving accessibility and transparency within healthcare.
He said that he thinks scientists should release all their raw data, transparency. He used transparency, threw it around a lot. And the raw data was one way that was, and he said there should be more replication of studies. But that was about it, I think.
There was certainly no transparency in what he would provide to consumers that we didn't hear. There was certainly like transparency that he did say he would answer senators' questions and he would not, he would, not hesitate to answer their questions. But certainly didn't hear anything about what data consumers would have on healthcare. There you go.
Was there any mention of the future of the Affordable Care Act and or his opinions on the Affordable Care Act in the past? I saw that several people tried to pin him down on the expiring subsidies for the Affordable Care Act. He seemed to sort of not really want to answer those questions. Did I miss something?
It came up, but at least in Senate Finance, we didn't hear him respond when asked about if, 'cause again, Republicans clearly have said they do not want the enhanced subsidies to continue past this year, which they would not unless Congress acts. He didn't answer the question at Senate Finance. And again, I can't recall, he didn't, not just that, in 3.5 hours, he didn't really mention the idea of that we need to improve insurance coverage in the United States. So not just the ACA, but the words of, hey, even with the incredible strides made in lowering the percent of uninsured in this country, and to be sure, we right now have the latest stats, we have the lowest rate of uninsurance in this country with the latest data. But still leaves millions of people without insurance. He didn't echo a word that I could hear in those 3.5 hours about how to help people access care or access health insurance. Arthur, did you hear anything?
No, I didn't remember him saying anything about that. He seemed to be, I mean, one thing that he repeated a couple of times was, this is getting to price more than insurance coverage, but he said, it doesn't matter, if we blame insurers or doctors or hospitals or whoever pays for it, we're just paying too much because we're too sick. So in a way, that was something that I thought, hospitals and insurers would sort of be happy to hear him say, because he was like, the focus, during the last 4 years has been on, well, are we going to change something with the PBMs? And are we going to maybe change 340B so that hospitals don't get, special privileges for, or, extra padding their bottom line with that money. And so it's always about, payments among the different payers in the healthcare system or the different, service providers. And he did say, and I thought that was kind of interesting, actually. He just assumed, there wasn't any healthcare and we were all just eating our vegetables.
I was and he said this, I think, at both hearings, and I was a little bit surprised to say, that the problem isn't who pays for it, that so much of Washington is this fight between should the government do more, should the private sector do more? And we do sort of take our eye off the ball of, oh my God, the problem is that we're paying too much, period. And all you're trying to do is figure out which one should pay. Everybody's passing the buck. He kept calling it rearranging the deck chairs on the Titanic, but there's actually, it's not incorrect. I mean, we are clearly
but
paying
to be sure, to make any major changes in this country in healthcare have to do with how we pay for it. It's not, we can't just willy-nilly say, hey, we're going to improve healthcare. Change is often made by how we pay for it. And that's why we talk about what policies does Medicare have? What policy does Medicaid have? How is private insurance operated? Are there incentives to have you spend, it used to be in the country, the incentive was to have you spend as much time in the hospital as possible because Medicare was paying for every day. And that was the incentive. And then in the 1980s, they finally came along saying, we can't afford that. We need to reverse the incentives and say, hey, you know what? We're going to pay you based on a set fee when you go to the hospital. So that's the hospital does not have an incentive to keep you as long as possible. So the way we change healthcare in this country is often the way we pay for it. And RFK also mentioned how he was very rah-rah for private insurance. And when he was asked about Medicare and Medicaid, he said, people love private insurance in this country. And that's what we need to get more people into private insurance. Obviously, that's not totally the case. We went through in the last number of weeks, it's become a bigger issue. Raise up some of the questions about private insurance and the questions of does that have too much power in denying people services that they need and in not paying the bills and leave people too much out-of-pocket expense. So those are some of the questions. Clearly, there's a gray area. Private insurance does do a lot of great things, but obviously there's a lot of things to fix as well.
Yeah, and right exactly along those lines, he said, did you get an indication there will be a push to convert Medicare to private insurance? That's something that many Republicans have been pushing for a long time. Is HHS in charge of this? Medicare Advantage has had some trouble operating well for patients and caregivers. He did say he was on Medicare Advantage and liked it very much.
Yeah. And he also did mention that one reason people don't go to Medicare Advantage is because it's too expensive, which again raised some eyebrows because many places around the country, it's actually cheaper to be on Medicare Advantage because in many places in the country, there is no premium. Their premium is very low. And by having Medicare Advantage means you don't have to spend money every month for a Medigap policy that will pick up the cost that Medicare pays 80% of the cost for your healthcare. And you don't have to pay another policy to pick up the other 20. Your Medicare Advantage policy will do that. So again, that raised questions about did he really understand how Medicare Advantage works compared to traditional Medicare?
Right. Well, in that first set of questions, the two polls he was talking about were Medicare Advantage or Medicaid, which didn't make sense. I mean, he meant Medicare, presumably, but he got confused and he never corrected himself.
Right. On that, of course, we have to mention when he was asked about, he said people like Medicare, they love their private insurance, and he also said most Americans do not like Medicaid.
Right.
And again, the data doesn't support that. The latest data that KFF does polling on this all the time, and actually Medicare and Medicaid are both equally liked by about 80% of the country. 8 in 10 people have a favorable rating of both programs. Yeah, Medicare,
including people who have them.
Right.
Yes.
Medicare may be a couple points higher, but Medicaid is pretty high. This is, for many years, Medicaid was sort of was considered the ugly stepsister, right, compared to Medicare. But in the last decade, especially since the Affordable Care Act, Medicaid has become much more well known. And again, during the pandemic, we had upwards of 93 million Americans on Medicaid. Now it's dropped down back to about 78, 79 million, but still a lot of people got to know Medicaid, and just about everybody knows somebody. If they're not on Medicaid, you know somebody who has been on the program.
No, I think the one thing the Democrats learned in 2017 during the Republican efforts to repeal the Affordable Care Act is that Medicaid is more popular than anybody thought. And particularly the role that Medicaid plays for taking care of people in nursing homes. And, many people have a parent or a grandparent whose long-term care is being paid for by Medicaid. And that, in the end, I think was really what turned the tide against the repeal of the ACA.
And a major payer of substance abuse. Again,
That's right.
That came up talking about with RFK, and that's a major personal issue to him and his family. And obviously, it's the major payer for substance abuse in this country.
He also made an incorrect statement about that, if you mentioning the substance abuse, in which he said that the gold standard was a 12-step program. Actually, I mean, the gold standard is medically assisted treatment.
So I know there were questions about this. Someone said, what about the shortage of the medical workforce? Does he have an idea to increase?
Didn't come up at Senate Finance, to my knowledge.
It did, because he kept talking about GME. I know. I remember it came up because the graduate medical education payments.
There was some talk, yes, about to try to shift more to have more care in rural areas. Again, how that would happen, and again, it's a pie. And again, are they going to take some stuff out of urban areas, put that there? Are they going to increase the pie? But yeah, he did say, hey, it would be nice to have more residency slots in rural areas. But again, I don't think anybody would disagree with that. The question is, where is that money coming from?
Yeah, but he talked about the GMA program as if it was paying for medical students as opposed to paying for residents. Suggesting that's something else that he needs to kind of learn about exactly what the role of the federal government is in paying for medical education, i.e. it doesn't pay in most cases for undergraduate medical education, but it does pay the salaries of residents, although as many experts have said, probably not enough. All right, we're coming to the end here. Let's see. Someone asked if he talked about telehealth coverage at all, if telehealth services will be impacted or restricted, especially for sexual and reproductive health care like medication abortion.
Again, I think he was asked by Senator Cassidy to give some specifics on how he would reform Medicaid. Telehealth was, again, one of those buzzwords that he brought out. Again, no specifics on it, and it's really unclear. Again, telehealth increased dramatically during the pandemic as people did not want to see in person, and some of the laws changed that enabled more coverage of telehealth, but RFK certainly didn't provide any details.
He at one point he said that we could use more AI sort of avatars to treat people in rural areas.
Just something that they're doing for mental health and for substance abuse.
Mm-hmm.
Do we have any idea what RFK Jr.'s strategy is for Medicaid? For example, does he support work requirements?
He didn't, I don't think he gave any specific answer on that, did he? Or did he?
At Senate Finance, he was asked, but he did not answer. To be fair, a number of Democrats were asking him 5 or 6 questions at once with limited time, so he didn't answer every question. But he was asked, but to my knowledge, he didn't answer. And again, be surprised. Part of me is, does it matter? Donald Trump and other health advisors to Trump have said they want Medicare work requirements. Is it really going to matter?
Medicaid.
Is RFK really going to push back on that? Certainly don't have any indication that would be true.
All right, we're about to wrap up. I want to give you each like a minute or two to tell me what sort of stood out. What did you learn, either about the process or about RFK Jr. from watching these hearings? Arthur, why don't you go first?
Sure. Well, I mean, I guess the thing that struck me about it was that RFK Jr. sort of managed to give certain answers that were like the expected answer about vaccines or about other issues. But he was pretty, he was pretty obstinate and stuck to his guns in a lot of areas. And, just, one thing that really struck me about this was that he just wouldn't have been there if it weren't for the pandemic and what it did to trust in public health in this country, because he represents, his movement represents, people who are pissed off about, what happened during the pandemic and joined with anti-vaccine movement types. And so, it's just interesting to me just how willing at least half of Congress is to go along with that. Because his views are so out of the mainstream. And he kept referring to this series of hearings that were held 20 years ago by Dan Burton and by Dave Weldon was involved in them also, who's the new CDC nominee. And they were basically claiming that FDA and CDC had covered up autism as a cause of, that vaccines as the cause of autism. And it just disappeared. They held maybe 10 hearings and they just faded away and nothing came of it. And they were very poorly attended.
I went to those hearings. They actually weren't that poorly attended.
Were they? I went to them too. I just don't remember. There was really not much.
But you're right. Nothing came out of it.
And now here we are, and somebody with those ideas is about to become head of HHS or possibly. So I guess that's really what stuck with me.
Bill, what jumped out at you?
What stuck at me was right. I mean, the nomination, of course, is a shocking thing, and I think part of it goes back to he ran for president. President Trump wanted to get his votes, so they had met and they befriended each other, and maybe this was the reason why why they came back together was because Trump had vowed that he would have some position in his cabinet. But certainly it seemed like there was sort of like a sort of deer in the headlights appearance at Senate Finance. I mean, he was under the bright lights. I mean, it was a packed room. I mean, there was probably about 300 people there. There were about 100 press there, probably about 35 photographers standing in front of him when he walked into the room. So certainly he knew he was under the lights. And other than preparing and to sort of saying what some senators wanted to hear, that he would support vaccines, that don't believe what I'd said before, but I'm going to say the things you want now, that I will listen to the senators, and I will all of a sudden I will not do it. I won't take vaccines away. And he kept repeating that. Beyond that, there wasn't a whole lot there. There wasn't much of, hey, in my history, I did this and this, and I'm going to bring this to bear, because I did throughout my career. There wasn't much of that at all that I heard. And
although he did say only he could fix it, sort of an echo of Trump, that only he could fix the health system.
Right. And again, just a general lack of knowledge of the major health programs. It was sort of shocking. I mean, again, were these gotcha questions when they were asking him to explain Medicare and how Medicare works when he's going to be heading up the program? Is that a gotcha question? Or if this was a job interview, would you even get into the door without knowing what Medicare Part A is and Medicare Part B and Medicare Part C, or you even get in the door not knowing the difference between Medicare and Medicaid. So this was a job interview basically before the Senate, and obviously a number of senators have decided how they were going to vote on both sides, and clearly there was only a handful of senators there who are going to make the difference here, and as we talked about, it really comes down to Senator Cassidy and which way he's going to go.
Well, we're going to have to leave it there because we're out of time. Thank you all for joining us. Thank you, Phil. Thank you, Arthur. And we will be back in